You're listening to the station that serves your community. AM 1240 WGBB.com and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. I'm your host, Dr. David Scharf. Tonight we're going to have a great show tonight. Tonight we have a great guest, Dr. Walter Rostkowski. Walt, welcome to the show.
Thank you very much, Dr. Scharf.
I appreciate you taking time out of your busy schedule to be here with us. For those of you who don't know Dr. Rostkowski, he's really one of the South Shore's experts on dentistry, cosmetic dentistry, and we're going to really pick his brain tonight and learn a lot about dentistry. So, Walt, before we get started tonight, tell me a little bit about where you practice, how long you've been in practice, that sort of thing.
I graduated in New York University College of Dentistry in 1990. And I've been practicing in the beautiful town of Sayville since 1996, so 1993, 19 years coming up.
And your practice had been in Sayville way before you took it over, wasn't it?
Yes, it was an existing practice, and I bought it from Dr. Bob Logomassini. It's been a practice 47 years.
47 years. You must be doing something right to be in practice 47 years these days.
We like to think
that's
so.
For sure. Kodak's going out of business, but you're still in practice. That's a terrific thing. And I know we were talking before the show that even after dental school, you went on for some advanced training. So tell us about that.
Yes, I was accepted into the program at NYU for the advanced education in general dentistry. It was a great program, treated a lot of advanced cases, and really cut my teeth in there in the tutorage of some very fine New York dentists.
Mm-hmm. And then you went on beyond that, didn't you? You did some other training down in Florida.
Yes, I've taken many courses. I've finished a course with Dr. Pete Dawson, who's one of the gurus in occlusion and dentistry, and learned a lot from him and some other of the well-known speakers in the field.
Yeah, most dentists don't go to that limit. I give you a lot of credit. Most dentists get out of school, they can't wait to start practice, but they really mean practice. So I think it's great that you did those trainings and that you bring that level of care to your patients. So congratulations.
I love what I do, and I practice long, hard hours, but I really enjoy what I do. And I talk dentistry all day long if I could.
You know, I want to talk a little bit tonight about some of the advances in dentistry because there's been so much that's gone on lately that I think a lot of our listeners maybe don't know about. And I know you have quite a bit of technology in your office. Mm-hmm. Let's just talk a little bit about some of it first. You were telling me before we started that you have some pretty advanced techniques for detecting oral cancer. So let's talk about that.
Oral cancer is on the rise. And we take an active role in finding that. We see it from all age groups now, from 18 years old on up. And we have a system called Visalite, which is a very simple way. You swish your mouth with the mouthwash, and then we have a light that detects if there's anything that isn't quite normal, and then we can proceed from there.
Mm-hmm. Almost like a pap smear, it sounds like.
Yes, it's very routine like that, and we hope and encourage our patients to do it at least once a year.
So using that Visalite, that's a more sensitive technique for detecting oral cancer than just, say, a regular examination a dentist would do.
Yes, we do a full visual exam and a head and neck exam, but we also rely on the Visalite because it finds things chemically that we can't see visually.
And I would think, like every cancer, early detection is the key.
Absolutely.
How's the response from patients been when you got that technology in the office?
Response has been good. They were amazed that oral cancer is on the rise, but I think the ADA and dentistry in general has been doing a pretty good job educating, so it's not so much a surprise anymore.
You know, I read a statistic the other day that more people die every year from oral cancer than from melanoma. I was shocked when I read that.
Yeah, I've seen that.
That's something.
Yeah.
Okay, well, let's go on. You know, the other thing we were talking about a little bit before the show was this whole concept of minimally invasive dentistry. So, you know, when I was a kid, and probably when you were a kid, you know, we'd have a filling and you'd be sitting back in the dental chair and, you know, the dust would be flying out of your mouth and you'd end up with this big silver glob in your tooth. But you were telling me you have some pretty specialized techniques that has made that obsolete. So tell our listeners about that.
Yeah, thankfully those days are gone. Chemistry has been our best friend. We have some great materials out there. And technology, as with cell phones and laptops and whatnot, technology in dentistry today is absolutely fantastic, and it's a thrill to use it, and the patients love it. We have some really, really cool things.
So tell me what that means minimally invasive dentistry, what does that mean to me as the patient?
Sure.
How is it different than what I had when I was a kid?
I believe what Mother Nature put there is better than what we could do, so we preserve as much tooth structure as we can. So the less I have to drill away, the less the filling takes up the space of the tooth. Mm-hmm. So we respect nature, and we keep our restorations as small as possible, many times without anesthesia.
Is that right?
Yes.
Huh. So what's the advantage of treating it when it's so much smaller like that and preserving that tooth structure?
Well, it's so much easier to handle. It's less invasive, not so close to the nerve, very, very little post-op sensitivity. As a matter of fact, it's hardly any. Mm-hmm. Patients are comfortable, and again, preserving tooth structure.
Well, I bet patients are pretty appreciative that you bring that to them.
Yeah, they love it, especially not being numb.
Yeah, that's got to be a great thing. And you mentioned fillings a little bit, and I know you have some amazing technology in your office that actually makes the restorations. So tell our listeners about that a little bit.
Yes, we have something I'm very proud of. We have it now a little over 5 years. It's called a Cerec Machine. Mm-hmm. And remember the days when you had to have a crown or a restoration, and you had to prep the tooth to make it fit, and then take the impression with that delicious material, and then the patient would wear it temporary for 2 weeks, and then the lab would make the restoration out of maybe a gold or a white gold metal and porcelain over that, and the patient would have to come back in 2 weeks and get numb again, and then the crown would go in. But now with the Cerec machine, instead of taking an impression, we take an optical impression. It's actually a scanner, a camera that fits in the patient's mouth, and we can show the patient what the restoration looks like while it's being made on the screen, and then the computer generates the image wirelessly to a milling machine, and it looks like a robot, and it mills the restoration out of a matching block of porcelain.
Right there in the office?
Right there in the office. One visit, no temporary, no impression.
So you can sit there, you have your tooth prepared, you can sit there, and you can watch the robot make your filling.
That's right.
That's unbelievable.
That's right.
I would imagine, and correct me if I'm wrong, but I would think that the old-fashioned way of doing it, where a lab technician made the restoration, he had a good day, he had a bad day, he had a fight with his wife, his kids were aggravating him, maybe there was variation, but, the computer, as long as it boots up, I would think it turns out a perfect restoration every time.
It does. It does. The junction of the filling or the restoration of the tooth structure, you really can't even see it. It just fits so well. It's a wonderful tool to have, and it's great to provide that to the patient.
What do people say when they see that? They see the machine making their filling.
Yeah, they actually sit there and watch it, and we get many, many wows as they watch it. They also love that they don't have to come back.
That must be a huge time saver.
Mm-hmm. It is. It is. We understand people are busy. Listen, we're busy. We have family. We have children. We have jobs, sometimes 2 jobs. And when you can provide that quality of restoration in one visit, and the patient says, "You mean I'm done?" Yeah, you're done. One visit, go home and chew on it right now.
One visit, one injection, one taking time out of your day. Yeah.
Yes, and it's also tooth-colored, and it is metal-free, and that's becoming a new avenue where they're pursuing.
So what's the quality of that restoration compared to, the old-fashioned restorations? Is it equivalent, better, slightly not as good, but more convenient? Where would you rate it?
It's certainly more convenient, and it is better. It wears. It doesn't wear the opposing tooth as much as the old porcelain crown did. Mm-hmm.
And when those are put in place, do they help to strengthen the tooth that they're put into? And does it make it stronger from where it was weakened from the cavity?
Yes, it does. It actually is bonded to the tooth. We used to use cement, but now we have bonding agents where the tooth is reinforced, and the cement can chemically grab onto the restoration and grab onto the tooth at the same time. So the cement is unifying the restoration in the tooth.
And how do they look when you open your mouth at the end?
Oh, it's absolutely gorgeous. It's like it was never touched.
Really? Do people say, it doesn't look like you did anything? What's going on?
Most of the time they say, which tooth was it?
Oh, yeah? That's great.
The greatest compliment you can give me.
That's great. So why doesn't every dentist, I should ask you, does every dentist have this technology?
No. It's popular, but it's not in every office.
Yeah. So why did you make this investment compared to, why did you choose to make the investment for your patients and maybe so many people don't?
I did the investment of time and, of course, the financial investment about 4.5, 5 years ago because I saw the value in this. I myself do not like to have impressions taken. I have a little bit of a gag reflex, and for those many, many patients who are out there like me, this eliminates the need for the impression. So I had a little bit of a selfish reason, but I saw the benefit in time and in potential health.
Yeah, I bet your patients really appreciate it.
Oh, they love it.
I bet you they appreciate it.
They love it. I get a lot of stories. Patients will come in and say, my neighbor just had a crown done. He's got to go back twice. I just walked home and told him I was done.
And hands him your card.
I would hope so.
That's a good thing. That's great. I give you a lot of credit for doing that. I talk to so many dentists who hem and haw and agonize over things, and you just did the right thing. You said, what's best for my patients, and you did it. I give you a lot of credit. I
always look at it, if it was my mother or my wife in the chair, this is what I would want for them. So that's what I produce for my patients.
That's great. And the list doesn't stop there. I mean, I'm just amazed by what you have. You were telling me just before that now you have digital x-rays are coming into the office.
Yes.
So maybe tell our listeners what the advantage is and why they should look for a dentist that uses digital x-rays.
Sure. Digital x-ray has been around for a few years, but I think it's been perfected the last year, and the latest systems that are out there are really fantastic. It is the use of a computer sensor that is tied to a computer to capture the x-ray. The big plus for it is that it's about 50% less radiation. So patients are concerned about that, as we all are, and that's a big plus. The quality of the x-ray is far superior, and now the x-ray appears within 2 or 3 seconds on a monitor. And in my office, the monitors are 21 inches, so now you look at an x-ray of a tooth that is 21 inches high, and you can really see the detail.
Must really help patients understand what's happening in their mouth to help them actually see the problem, as opposed to those little x-rays that would always be held up.
Right. People would say, I don't know how to read an x-ray, doc. I said, well, you don't have to. I'll walk you through it. But now on the screen, it's like watching any other video game, and we're all in tune to that now with technology the way it is.
What about chemicals? Does it do away with all those those smelly chemicals and all that stuff?
Yeah, it does. As a matter of fact, it makes our job in the office a lot easier and eliminates a lot of toxins from the office.
So you're a little greener.
Oh, always a little greener, yes.
A little greener. So let's talk about your practice a little bit.
Sure.
I know you've been in Sayville a long time, and your predecessor was there a long time as well. And
yes.
For those of you who don't know Dr. Rostkowski's practice, I mean, he has the highest reputation anyone could possibly have on the South Shore, and he's a heck of a nice guy and a very good fisherman. If you like to fish and you like your teeth, I urge you to go see Dr. Rostkowski, because he's a master fisherman.
Thank you.
But tell me, who's the typical patient that comes into your practice? What's your practice like?
Sayville is a middle-class neighborhood, a lot of families, and the typical patients are husband and wife and 2 or 3 children who may need some restorations, but the majority of the practice is geared for prevention. We do a lot of restoration, and we are very proud of that, as with the Cerec Machine and other things that we have. But the typical patient is someone who cares about their health and wants to look younger, wants to fix maybe a discolored filling or chipped tooth. And we see all patients from age 3 up until 103.
Yeah. Do you do, so is treating kids a big part of your practice?
Yes, it is. Yes, we are a true family practice, and a big part of our practice is pediatric, probably 25%.
Yeah. I see your face light up when you talk about kids. You must really enjoy treating kids.
I do.
Yeah.
I do. I have two girls of my own. My oldest is 12, that's Jenny Rose, and Annalise is 7.5. And I feel for the children, thinking back to our days when we were kids. The dentist was not so much fun.
Horrible. That's putting it kindly.
Yeah, it was a primitive experience, but it doesn't have to be, and it isn't. In my office, it turns out to be a very good time.
Yeah. So what's the most challenging part of treating a child?
I want them to have the best possible first experience. I don't want any repeats of what I had. Dentistry has changed. It's a wonderful profession, and it's nice to be a part of that change. But the children walk out of the office, and they can't wait to come back.
Yeah. Do you have the stickers and the buttons? I used to always get a whistle and a compass when I went to the dentist. Do you have that too?
Yeah, we have a treasure chest that they get to pick prizes in, and they get a goodie bag with their own toothbrush, and it's a lot of fun things, coloring books.
Yeah. I know you were telling me beforehand that prevention has really come a long, long way in the time you've been practicing, and that you really stress prevention. And again, I give you credit for doing that, because when people don't do prevention, they end up needing more dentistry. So it's kind of nice for your patients that you care about them and do that. But what are some of the things a patient should include in their prevention checklist? If I'm listening now and I say, you know what, I don't want to get cavities, I don't want to have these problems, what should the average patient do on a preventive basis to stay healthy?
Sure. The average patient should see the dentist at least twice a year, most likely 3 times a year. Every 4 months we find to be a better recall. But for home care, there are so many new things that are out on the market. First and foremost would be the Oral-B toothbrush. I'm a big fan of the electric toothbrush. It cleans so much more efficiently than a manual brush. and there are some very good quality toothpastes and mouthwashes on the market. There's quite a few different brushes that can get in between teeth and hard to reach places, and floss. But there's a lot of tools and tricks. It's not just simple brush for 2 seconds and out you go.
We're going to take a quick break. When we come back, we're going to talk about what keeps people away from the dentist. I'm Dr. David Scharf. You're listening to Healthy Living Radio.
This is Healthy Living Radio with Dr. David Scharf.
Okay, we're back. We're back. I'm Dr. David Scharf. You're listening to Healthy Living Radio, and we're talking with our local expert, Dr. Walter Rostkowski, a dentist in Sayville, about all things dental. And I would guess you see a lot of patients who come to your practice. Maybe. Well, first, let me ask you: how do most patients come to your practice?
We get most of our patients through word of mouth. My feeling is if you have a certain population base and keep them happy, they will tell people who are like them, and good people refer good people.
It's only been 47 years. Are you sure that strategy is going to pay off?
I'm betting on it.
So when you get people maybe, and I'm sure you see this, people who haven't been to the dentist in 5, 10, 15, 20 years, 25 years, what do you think is the biggest reason maybe that keeps people away from the dentist for so many years?
I think the biggest reason is still fear. It's probably second is the financial aspect of it. But we in general, dentistry in general has done a great job, and we have done, I think, a very good job in allaying their fears, showing them
what are they afraid of? What are they?
I think most people are afraid of pain.
Yeah.
But with the anesthesia techniques we have today, even the injection is painless. And with things like Cerec, where there's no impression, so people aren't afraid of gagging. Also, they're concerned with time, and Cerec also is a big part of that. But we try to schedule people at their convenience. We have early morning hours, we have evening hours, and we have Saturday hours.
Do you find most people when they come in, whatever their fear was, that in the end their fear was realized, that it was, or they say, boy, I can't believe that was nothing. I don't know why I was worried about.
Everybody says that. It's a preconceived notion, unfortunately brought about by a lot of the comedians. If you watch either Letterman or Leno, they're going to make some dental jokes once in a while.
Highly offensive. I don't watch those shows.
Well, most of the time we are the butt of the joke.
Yeah.
And it's our job to educate the people and show them that it doesn't have to be that way. And it isn't.
You see a lot of things on TV now, smile makeovers and all these smile enhancement techniques. What are some of the things you do in your practice for people who come in who aren't happy with their smile?
The biggest complaint we get is that they don't like the color of their teeth. So we have 2 systems that we use to whiten their teeth. One is a tray system, and they take that home and they use it while they're sleeping, which works really well. And then if someone wants a quicker, can't wait for that time period, we have the in-office Zoom whitening. And both are good, and both have their benefits.
Is there any kind of typical patient who comes in for that type of treatment?
We've been seeing a lot more of the younger people coming in, specifically young ladies, 16 years of age, waiting for their Sweet 16 party. We've been doing a lot of those, and we do a lot for graduation as they go out on interviews in this wonderful job market. People looking for the advantage, and everybody knows a bright white smile is sure opening the doors.
It's amazing. Having sort of an average smile that 30 years ago was okay is almost considered dingy now. The bar has been raised
Absolutely.
Quite a bit. Who are some of the other patients that come in that do cosmetic dentistry in your practice?
We might have someone who maybe fell and injured one tooth, and it has a bonding on it, and the bonding now is turning color. So we'll whiten the rest of their teeth and maybe place one porcelain veneer. We still get a fair amount of patients who don't like the shape of their front 6 teeth and the smile, and we'll do 6 veneers on that.
Tell our listeners what a veneer is.
A porcelain veneer is very similar to a fingernail extension for those of you who may use them out there. It is a clear, thin piece of porcelain that we can bond to the tooth. It actually reinforces the tooth, and it changes the shape and the size, and you can function perfectly normally with it.
So that sounds like a pretty conservative restoration as well.
Absolutely. Years ago, you'd probably have to do a crown, which again would involve metal and porcelain. This is strictly porcelain. And many, many times we can do them without the patient being numb.
Yeah. It sounds like a lot of the restorations you do have no metal in them, that you've really tried to get away from that.
We've been trying to get away from it. Research has shown that the metal-free restorations equal or surpass the strength of the metal restorations. And I think in general it's probably not a great idea to have metal in the mouth.
Why do so many dentists still use those metal restorations?
I think it's a comfort level. We were trained to do that. And in some instances, they do work, and they are still very highly functioning. But I think the next step, the next generation of materials will make those obsolete.
They're not state-of-the-art anymore. The metal's okay, but it's not state-of-the-art.
Right, exactly.
Right? It's like the old joke of the guy who's have you been in practice 30 years, or have you repeated your first year of practice 30 times? Right? It's unfortunate. A lot of people repeat the first year 30 times.
Sure.
So if I'm listening and I want to say I'm unhappy with my teeth, or I haven't been to the dentist in a long time, call up your practice. I want to come in for an appointment, but I really am unhappy with the cosmetics of my smile. Mm-hmm. Can you walk me through so I get a picture in my mind of what that process is like, how we go about working up how my new smile is going to look?
Sure, absolutely. Our first visit would be a full set of x-rays so we can see what's going on in between the teeth and under the gums. And then I would come in and do a full exam. Mm-hmm. And the full exam would include a smile evaluation and checking the bite and how the teeth come together.
Right. So what is that, a smile evaluation?
I ask the patient what they don't like. And sometimes they'll tell you, or they say, I just don't know. I just want it to look better. We're getting a lot more requests for being a youthful smile. Mm-hmm. And it's a rapidly growing portion of the population who are still in the workforce in their 70s and don't want anyone to know that they're 70. There's no reason to sit home and wait for the end. Mm-hmm. They're out there being active, and food is a big part of it, socially, restaurants and social gatherings. And they want to be able to smile and chew, and we can do that now.
So what's the oldest patient you ever did a smile enhancement on?
We actually did a smile enhancement on a woman who was 86 years old.
God bless her, 86.
Yes, 86.
Now tell me the story behind that. How did that come about?
Her granddaughter was getting married, and she didn't want to look old.
There you go.
And she looked very nice, I have to say. The smile came out really pretty.
Now, for how many years had her smile been bothering her?
She was a patient of mine, probably 15 years.
Mm-hmm. And all those years, had she ever mentioned it to you before that?
No, she never did.
It just came out.
I guess maybe the granddaughter said, Grandma, you're going to be announced and walk in, so I want you to look your best. And that was enough of a motivational factor.
So what did she say to you when she finally had it done?
Oh, she was ecstatic.
Yeah?
Yeah, she loved it.
Did you regret not having done it years earlier?
I think she did, sure. I don't remember her saying it, but I think she did.
Yeah. You know, when those TV shows like The Swan or those makeover shows where, people have all kind of cosmetic work done, and most of them have their teeth, made
sure.
much nicer, and they have these, transformations almost in their personality. Mm-hmm. Have you ever seen patients like that where you fix their smile and really they blossomed?
Yes, absolutely. It happens more often than not. You take someone who's maybe a little shy and a little introverted, because their smile isn't what they want it to be, or they'll smile covering their mouth with their hand, or they won't speak much because they don't want people to see their teeth. And they finally come in, and we can show them what we can do. And when the work is done, they end up changing their hairstyle, they lose weight, they go to the gym, they meet a significant other, and life really changes.
So they have two significant others at the same time. That's got to be hard to juggle. That's got to be very, very satisfying, I would think, to have that with somebody, to be a part of that, right?
It is a wonderful part of the practice, and I enjoy that interaction with my patients.
I would think those people, too, they must say, why did I wait so long to do this for?
Again, education is maybe a little slow getting out there, but hopefully with shows like yours, and you can get the word out to thousands and thousands of people that dentistry, there's something out there for everybody. We can make them happy.
So if someone's out there, again, that's always covers their mouth when they smile, and like you said, the biggest barriers to keep them from coming in, what would you say to someone like that who's just been thinking about it forever?
Oh, I would say don't procrastinate any longer. Just make the phone call. Come in and meet us, and you'll see that there are certain techniques that we can do and make it such an easy experience that you'd say to yourself, why didn't I do this sooner? There really is no reason anymore. Even financially, there are several options that most offices have. We have something called Care Credit, which is an approved line of credit, interest-free for a year. Mm-hmm. So if you went to PC Richards and you wanted to buy a flat-screen TV and they said it's interest-free for a year, we'd all jump on it. Mm-hmm. So we offer a similar program for the profession, and that has made a big change.
I think sometimes people have in their mind that the people who get cosmetic dentistry are the wealthy, all the wealthy people. But what you said, your practice is really a solid middle-class practice.
Yes, it is. And I like to tell them that a great smile isn't only in Hollywood mm-hmm. or in New York City. Everybody wants to have a great smile, and with the technologies that we learned from places like that and now brought it into mainstream.
It's always interests me when you see somebody who's got beautiful hair, beautiful clothes, nice nails, nice pocketbook, and just teeth that are really neglected. And it always doesn't fit. Do you ever find that, geez, the teeth just don't fit the rest of the package?
Well, when you see people like that, give them my card.
I think I will. So we started to talk a little more about the process of when someone comes in and they don't like their smile. How much input does the patient have in terms of designing their new smile with you?
I rely on the patient a lot. I spend a lot of time asking the right question and then waiting for the answer. I want them to tell me what they want me to do. Sometimes their expectations are a bit unrealistic, but we've been managing to get them to be very, very happy with what we can do. But I have to tell you, sometimes it's something as simple as maybe one tooth is too long, and in 30 seconds I shorten that tooth right in front of them, and they walk out a new person.
And they probably thought, God, hit themselves on the head. I waited so long to do this.
Right, or a jagged edge. The human eye, in a smile, the human eye likes to see smooth lines. They don't want to see serrations on the edge of teeth. That tends to make it more of an older look. So within 2 or 3 minutes, we can smooth off those edges, and patients walk out beaming.
And do you ever have a situation where, someone looks at someone, you put up pictures of someone's smile and there are things that they don't like, and you're thinking to yourself, well, that's, you don't like ABC, but I don't like GEF. How do you handle those situations?
Sure. Usually it's something dental that I see, maybe a crossbite or something like that, where a tooth is in a bad position. But I address their needs. If that's what bothers them, I will certainly educate them on what I see that needs to be done. But their concerns are first and foremost.
Have you ever had a situation where someone came in for cosmetic dentistry, you put the case in, and they said, this is horrible, get this out of here?
No, I've never had that, thank goodness.
No. How do you avoid getting to that part? I would think if I was going to have, anything cosmetic done, and I'm on the radio for reasons, but if I was going to have something cosmetic done, I would maybe be nervous how I would look when it was done. So does the patient get a preview? Is there any way they can tell maybe what their teeth are going to look like beforehand? Yeah,
there are several previews. We would take a mold of their mouth and have the laboratory make the teeth in wax so they could see that. And then we can also transfer that mock-up, as we call it, to the mouth, and they could see it firsthand in the mirror. It wouldn't be permanent. It would be something temporary that they could look at.
They can put that wax actually right in their mouth?
A mold of the wax we would make, and that would slide over the teeth.
Huh, that's something.
Yeah, it's pretty cool.
That's something. Can they wear that home, show their spouse?
Yes, they can, actually.
Yeah, that's got to be pretty cool.
Yeah.
That's got to be pretty cool. Tell me about your staff a little bit. I know a lot of your people have been with you quite a long time.
Yeah, I am very proud of that. We have tremendously loyal people working. The front desk, Evelyn and Karen, have been with me 17 years and 15 years. And Debbie, my assistant, is a little over 14 years. And Lisa, my hygienist, is probably 13, 14 years. Priscilla's about 15 years, another hygienist.
Wow.
Yeah, so we have one big happy family.
It's really to your credit because first I would think the patients have to love seeing the same faces all the time.
Continuity means a lot, yes.
It feels like a family. I mean, that's their right. Dental family. And it speaks nicely to you because I'm sure employees wouldn't stay around 13, 15, 18 years if you were a crumb. So I think that's a really nice compliment.
Well, the way I look at it, thank you, Dave, but the way I look at it, I work in that office with these girls 12, 13 hours a day. If I'm not happy for 12 hours, there's something wrong with me because I chose them.
That's a long day.
It's a long day.
That's a long day.
And we have a great time. The time flies. We have a lot of laughs. We all get along very, very well. Even their husbands and I get along. We have a lot of things in common. Some of them are fishermen.
Oh, yeah?
Yeah, so it's a good time.
How old were you when you knew you wanted to be a dentist?
I was one of the lucky ones. I knew at 15 this is what I wanted to do. And since 15, this has been my goal.
How'd you know that?
I think dentistry is a good blend of two of my favorite things. I always liked science and biology, chemistry, physics. But I also was very good with my hands. I credit my dad for that. He taught us to be quite resilient and self-sufficient. And dentistry brings in both.
Do you come from a family of dentists?
No, actually I come from a very hard-working, middle-class New York City fireman, and my mom worked for the public school system.
Oh, yeah?
Most of my family are policemen.
I know you give back to the community quite a bit as well, and maybe just spend 30 seconds and tell our listeners. I know you're not the braggadocious type, but I think it's very impressive what you do, and I just want you to tell our listeners.
Well, we certainly support the troops, and we've done our share sending toothbrushes and other toiletries for them. But locally in the community, we do a lot of pediatric outreach. We'll go to the schools and teach the kindergartners about keeping their mouth clean. We also support the local police, and I'm a member of the Police Surgeons Benevolent Association, which is a very nice organization that supports New York City Police, Suffolk County, Nassau County, and state troopers. And we do a lot of work for the church, too.
Very briefly, we just have to wrap up. If any of our listeners want to get in touch with you, can you tell us how they can reach your office and exactly where you're located?
Sure. We are located in Sayville on Montauk Highway, on the corner of Lowell Road and Montauk Highway. And the address is 531 Montauk Highway, and the phone number is 589-9010.
And if someone's not ready for a dental visit, but they just want a web visit, how can they visit you on the web?
Sure. The website is Dr.Rostkowski.com.
Very good. Well, Walt, I want to thank you for being on the show tonight.
Thank you, Dr. Scharf. It's a pleasure.
It was a great show. I enjoyed it. You're listening to Healthy Living Radio. I'm Dr. David Scharf. We'll be back next week on the radio. Thanks for tuning in.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.